Hi everyone, welcome to chapter 1. In this chapter, we're going to go over the main parts of our healthcare delivery system in the United States. So we're going to see a little bit of just sort of like a little bit of what the rest of the quarter is going to look like. It's just sort of like a brief introduction. Okay? So in this slide, what I want you guys to do with yourself is to just look at this picture right here. Okay. This picture is showing this gigantic monster, and the side it's called a behemoth. And this represents the United States healthcare delivery system, right? And then everyone behind it, or is trying to get at the U.S. healthcare delivery system in some way. Okay, they're trying to get something from the healthcare delivery system. So with each of these individual people, they each represent some part of some component or fragment of the healthcare delivery system in the United States. Okay, so what I want you guys to do is look at each individual one, look at what they're doing, okay, and then think about what they might be trying to get at from the healthcare delivery system. Okay, so first there's the employer, and he's holding this net, okay, and the net is stands for quality. Think to yourself, why would an employer want to get quality out of the United States healthcare system? Okay, I want you to do this by yourself though. Start thinking of ideas. Think in terms of like what do employers do, or what role do they play in healthcare delivery? Okay, and why would they want quality out of it? Next, we have the government. Okay, and the government is holding this lasso for cost control. So what I want you guys to do here is think about the government. Think about what you know about the roles that the government plays in the healthcare delivery system. And why would the government want cost control? Okay. Then look at the provider. That's who's next. So providers, those are usually physicians, healthcare practitioners, nurses, midwives, PAs, nurse practitioners, people like that. Okay, so a provider, what would the provider want out of the whole healthcare delivery system? Okay, so think about that. Okay, think of the roles that they play and what they would be trying to get out of it. Okay, next we have the consumer. The consumer is really just everybody, because we all use healthcare, right? And the consumer is holding this arrow for access. Think of the role that the consumer plays, and you guys are consumers, I'm a consumer, so we should all be familiar with this and how the role that we play in healthcare delivery system and what we are trying to get out of it. Why would we want access? Okay, so think about that. Next, behind that, lastly, is the insurance companies. So what role does insurance have in healthcare, and what would they be trying to get out of healthcare? Think about that. Okay. All right. So these are just some broad definitions of the United States healthcare delivery system. Okay, so I'll go ahead and read these out for you. Broadly defined, in the United States, a healthcare delivery system in the United States would be the major components of the system and the processes that enable the people to receive healthcare. Okay, more restricted definition of healthcare delivery system would be the act of providing healthcare to patients, for example, in a hospital or a physician's clinic. Okay. So what would the primary objectives of a healthcare system be? First of all, to enable all citizens to receive healthcare services. Next would be to deliver services that are cost-effective and meet the established standards of quality. Okay, now throughout this whole quarter, what you guys need to be thinking of when you're looking at all the different components and fragments of the healthcare delivery system in the United States and how it works and runs and all the different things that we're going to go over in this quarter, I want you guys to be thinking about them from a manager's perspective and start thinking about them in terms of access, quality, and cost. Okay, and so that's why that's there. Think of everything. Look through all of these concepts through the lens of access, quality, and cost. Okay? So the United States healthcare system is very unique. It's not actually a system in like a true way that a system actually is, where it has like one thing and it affects another thing and then it connects to another thing and it connects to another thing. It's not linear at all whatsoever. It's very fragmented. And also we have no universal health care that is financed by the taxes like how the UK and Canada are. In addition, there's no entitlement, and what I mean by entitlement is remember the second slide of this lecture when you saw that picture of like the monster who represented the healthcare delivery system, and then you have those other people who are chasing that monster, and they all represented different fragments of the healthcare delivery system. Well, each one of those different fragments were chasing after the healthcare delivery system because they felt like they were entitled to something. They were entitled to get something out of the healthcare delivery system. And what I'm trying to say is the healthcare delivery system in this country has no entitlement, like no one fragment has any kind of entitlement over the other. Okay, so no one has more power than the other. Okay, the government doesn't have, the role that the government plays in healthcare has no more power than, other fragments in the healthcare delivery system. A physician does not have more power than like an insurance agency and such. Also, the United States as a healthcare delivery system, we do not operate like any other country at all. We're very unique, okay? No other country operates quite like we do, okay? And many of the issues that we do have relating to healthcare delivery have something to do with cost, access, or quality. So that's why I told you before, as you're going through the different chapters and the different lectures of this course, I want you to look at every concept through the lens of cost, access, and quality. Like pretend you are a manager, okay, healthcare manager or administrator, and you want to look at everything in terms of cost, access, and quality. So think about how the cost of something is going to affect such and such. And another thing about cost, access, and quality is they're all interrelated. Okay, so something may cost a lot and may reduce the quality or may increase quality and things like that. So they are all related. This is a list of the different subsystems that we have in the United States healthcare delivery system. So first we have managed care, the public health system, military systems, special populations, long-term care delivery, and integrated care delivery. And this course, managed care, is a whole chapter on its own. So is long-term care delivery. Integrated care delivery, that's something that's a bit new, and we may or may not go through it towards the end chapters. We'll see how this goes. Military is kind of its own, that's almost its own subset completely, because Military is going to be completely funded and ran by the federal government, and really we don't have too much, like everyday citizens are not going to have too much of a connection with how that is going to be ran. Okay, and then we have the public health system, which is separate from how we do medical care. And as we proceed through chapters 2 and 3 especially, we're going to kind of see how public health evolved in this country and why it's completely separate from medical health, from the medical care system. Because in many other countries, they're actually one and the same. They're connected. Okay, but in the United States, we decided to make them completely separate. Our public health system, that's all government. Okay, the government runs that sector. And then medical, that's private. Okay. This slide is just to kind of put in perspective of the different types of insurance carriers and how many people are actually using these different types of insurance in the United States. So as you can see, most Americans, or the majority of the Americans who have insurance, are going to have private insurance. Private insurance can come in two forms. So we have private insurance that is voluntary. Okay, and when it's voluntary, that means that you basically went out and went shopping and purchased your own health insurance for yourself. Okay, when it's employer-based private health insurance, that is the private health insurance that you get from your job. Okay, so there are two different forms of private health insurance, and we'll kind of get into more of that a little bit later in further chapters. And then we have Medicare. Okay, so about 43.4 million people in the United States receive Medicare. Okay, and 47.8 million people in the United States, or roughly around that much, receive Medicaid. Okay, so Medicare and Medicaid are the two most common forms of public health insurance. And then roughly about 50 or so million, it's probably a lot more than that. That number is probably somewhat larger. It's probably not 16.7%, but it could be about 20, 25. The thing is, a lot of this isn't really documented, but there are at least, I would say, in my probably roughly 20-ish% of Americans are uninsured. Okay. We've already kind of gone over this. Okay, so private health insurance. Like I said, there are two different forms. So we have the employer-based health insurance. That is what you get from your employer. And then private purchase health insurance. That is also called voluntary. So, let me see if I can write this on here. Just so you guys, oh, you know what? I have a pen. There we go. Let me do this. Voluntary. Okay, that is another name for privately purchased health insurance. Okay. Like I said, Medicare and Medicaid are the most common types of public health insurance. However, we do have a lot more. We have other different types of public health insurance programs that are available, but usually those ones, as we're gonna see in further chapters, we're gonna get into that a little bit more, but those other programs, the eligibility requirements are a bit different. Okay, it's usually not something that is very common or something that like most people can qualify for. Okay. Also, another thing we do need to address is CHIP. Okay, CHIP is a health program. It was formed out of Medicaid. Okay, and this is specifically just for children and it is completely funded, well, mostly completely funded by the federal government, mostly completely. It's funded for the most part by the federal government, and CHIP, basically, it's put in place to make sure that at least children are covered. Okay, so in those situations where, let's say, maybe the family, they can't necessarily go out and afford their own private health insurance, and maybe they're self-employed, or they could work for like a small mom and pop business or something like that that does not offer health insurance through their job. So they would have to go out and purchase their own health insurance. However, they might not be able to afford their own private health insurance for their whole family. But they don't necessarily qualify for Medicaid. Okay, they might not make that income eligibility requirement. However, for those families, the federal government created the CHIP program so that if that is your situation, at least the kids are going to be covered. Maybe not the adults, but the children in the house, the minors, will be covered through the CHIP program. Okay? Moving along. All right, so in the United States healthcare system, we have little to no networking. Okay? There's almost no standardization, almost no coordination, nothing like that. Like I said before, earlier in this chapter, the United States healthcare delivery system is not really a true system. Okay, it's not like it starts at one point and then it leads to like the next point, and then that works its way to the next physician, and then there's like one thing leads to another, and then you just kind of go along in a system, kind of like in a linear fashion. It's not like that. Okay, we just have a bunch of non-interrelated components sort of spread all over the place, and no one's really very coordinated with each other when it comes to caring for these patients. So we'll see a lot of different fragments not being very connected, not communicating well, not moving information along, and things like that. And when this happens, we get overlap, we get waste, we get patients who suffer because maybe their physician did not, or their physician's office did not relay the health information of that particular patient, or all of the information to the patient's other providers. Okay, so there's a lack of communication and coordination across the board. Okay, and we'll kind of see later that this is definitely a huge problem in our healthcare delivery system. But we are kind of getting better when we, for those organizations that share a network, okay? So those would be the integrated health companies and also the managed care organizations. Typically, they all have their own, networks, okay? So, and within that network, they usually share like an EHR system and things like that. And then that allows them to be a little bit more coordinated and to actually have standards. But when they're not part of a network like that, typically communication and coordination is a mess, okay? And it's the patient that suffers and is exploited in most cases. We kind of already gone over this. So the United States healthcare system, just to recap, we have a lot of duplication, overlap, inadequacy, inconsistency, waste, complexity, inefficiency, financial manipulation, and fragmentation. But it's all that bad, okay? So we've kind of covered all the doom and gloom about the healthcare delivery system. Now let's look at the good part. So the cool part about the United States healthcare delivery system is that we do lead in the world. We do lead the world in medical technology, medical training, research. We kind of have the best of the best in these departments. Okay, so something to be proud of. There are several characteristics that actually affect the United States healthcare delivery system. So the political climate, economic development, technological progress, social, cultural values, physical environment, population characteristics such as your demographics, their health trends, the migration coming into the country, or like immigration and whatnot happening, global influences, globalization actually, moving all over the place, going to get health treatments in other countries, people coming over here, we're kind of sharing our things, we're building businesses in other countries that are health related, same thing over here. I know China's opening hospitals in our country as well, so we have a lot of global influences in our healthcare delivery system right now as well. Okay, so there are 10 major characteristics that differentiate the United States healthcare system from the rest of the world. Okay, so we're going to go over that. First of all, the United States does not have a central agency. Okay, so just take that in for a second. Let's really try to break this down and understand it. Okay, the United States does not have a central agency. Basically what that means is that the United States doesn't have a central headquarters. Okay, if the United States healthcare delivery system were a business, that would mean that it doesn't have its own headquarters. Okay, does not have its own CEO. It doesn't have a governing board. Okay, it doesn't have anyone making any kind of policies that govern all of the different branches of the system. Okay, it's kind of crazy, all right, if you really think about it, because this is a huge industry in our country, and it's not governed by anything. All right, here's an example. Compare this to, let's say, Walmart. All right, Walmart, they have their central headquarters, right? And also they have a ton of stores everywhere. They have the neighborhood stores, they have the super centers, they have the regular ones. But the thing about Walmart is that you can go to, let's say, any neighborhood Walmart, and you know exactly what to expect there. You know how it's gonna work. You know what items you can purchase there. You know how much they're gonna cost. You know that if you purchase an item at this Walmart and then you decide you don't want it, you can go to another Walmart and return it and get your money back. You know that if you, let's say, I bought a shirt for my cousin at a Walmart over here, I know that I can send it to my cousin in Virginia as a gift. She can open it and be like, ew, I hate this shirt. I'm going to exchange it at Walmart for a different one. Or maybe she can say, this shirt is too big for me. I need to get the exact shirt, but I need a smaller size. Okay, she knows that she can go to her local Walmart in Virginia and get that exact shirt, okay, in her size. All right, because basically all the Walmarts are the same. The prices are the same. They sell the same stuff. Even the employees look the same, okay? They're the same, all right? And who organized that? Who created those policies and said that they all have to be the same? These are the items that you're going to sell. This is how much it's going to be. This is, these are the policies for the employees. This is, such and such, like that, right? that was the headquarters, that was the CEO and their governing board and how organized they are. Okay, now imagine if Walmart didn't have their central headquarters, okay, and all the different Walmart stores were still here, but in this world where there's no headquarters, they probably wouldn't be coordinated, right? They probably wouldn't be very connected. They probably would not have the same policies. I'm sure they won't be selling the same stuff. Most likely what would happen is they're all going to be selling their own thing, okay? They're probably going to be customizing their own store to the local demographics, and so everyone would kind of be selling something different. You would also see different prices for the items. Maybe Walmart's in I don't know, Beverly Hills would be more expensive than the Walmarts in Needles, California. I don't even know if Needles has a Walmart. But anyway, so they would be all different. And if you purchased a shirt for your cousin at your local Walmart in Beaumont, so you can send it to your cousin in Springfield, Virginia, she might not be able to exchange it if you don't get her the right size. Because they're not coordinated, they don't communicate, they probably don't have the same policies, they might not have the same prices, the same stuff, okay? So they would all be different and they would not be communicating well, and it would not be a true system, okay? So it's like that, okay? That is our healthcare system. We have no central governing agency at all. So that's why we're not really connected. Our health care organizations that we have in this country are not working in a nice linear fashion. There's no policies that explain exactly how we're supposed to work, how we're supposed to handle healthcare, that give us certain standards. There's no standards of pricing or anything like that. Okay, they're all different. It's completely privatized and everyone's doing their own thing. All right. Next, another characteristic that differentiates the United States healthcare system from the rest of the world is that we have this thing called partial access. Partial access for everybody. Partial. Okay, so what does that mean? It means that we don't have universal access. Okay, it's partial. So not everyone's going to have access to healthcare in this country unless you can really pay for it. Okay, and the primary mechanism through which we are able to pay for our healthcare is through health insurance. Now, we saw on one of the earlier slides of this chapter that roughly 20-ish% of the people in this country do not have health insurance, so that means they do not have access to healthcare. Partial access, all right? We have partial access in this country compared to other countries such as the UK. All right, they have universal access. That means that all the citizens have basic access to primary and routine care, and other levels of care, kind of depending on need or however their government sees fit, however they're able to distribute the health resources throughout their country. Okay, we don't have that. Okay, we our healthcare system is highly privatized, and we need health insurance in order for us to have access to healthcare when we need it. Okay, so we are not in a completely free market. Okay, so we're in a quasi-market, which makes it means that it's not completely free. Like some of the market is going to be governed by the government and things like that. So as opposed to what it could be in a completely free market. And if it were in a completely free market, it would be governed by the laws of supply and demand. Okay. For example, like if we decided that we were going to say forget health insurance and we're not doing that stuff anymore. Okay, and everyone's just going to pay cash for all their health care. Okay, in a market that is completely free and it's governed by supply and demand, what would happen there is that in the market, the providers who are the healthcare organizations, the hospitals, the doctors, whoever, your providers, they are going to set the prices. They're going to, they're going to tell you what's wrong with you. They're going to increase the demand for their services because obviously you don't know, you're the patient, you go to them for help when you think you're sick. So they're going to tell you if there's something wrong with you, what you need, what treatment you're going to have. So they induce their own demand for their services, right? Our services, typically we think of healthcare as extremely expensive. The truth is, it's only expensive because it's a quasi-market, all right? It's not completely governed by supply and demand. If it were governed by supply and demand, what would happen is the competition would be extremely steep, okay? Competition among providers and hospitals and, private practices, multi-specialty, everybody, okay? Competition would be so steep, it would be very cutthroat, and they would be constantly competing for your business. So what would happen in that situation is that you would see a normalized, normalized prices, okay? So they would start pricing everything in such a way that is more affordable for the American people, okay? Something that actually makes sense and it's very reasonable and you can actually pay for. They would have to, otherwise they would not get business, okay? But that's only if it were in a free market. The thing is, we're in a quasi-market, so if we decided to switch over to that whole system where we all just pay for our own healthcare and no insurance or anything like that, we can't do it. It wouldn't be affordable because there are other laws in place that kind of take away competition, if you will. So we don't have a free market, and that's another thing that makes us different from other countries. Next, this kind of goes back to the other side. We have this whole supplier and provider induced demand. Supplier induced demand and provider induced demand are pretty much this. You can use these words interchangeably. Okay, so supplier or, go back. Man, why do I suck at technology? Anyway, basically supplier and in provider induced demand, that reverts back to the whole concept of, it kind of ties into the whole free market situation. So in any situation really, the providers or the the healthcare workers, the physicians and such, they induce the demand for their services. Okay, it's not the other way around. They have the knowledge. Okay, they know what treatments you need. They know what you should have. So they can induce the demand for their services. Once you go in and go see a physician, and they they give you all these diagnostic exams and tell you what's wrong with you, what treatment options are available to you. That's all them, okay? They kind of drive that whole situation, okay? They can get you to need their services, all right? And that can actually be quite toxic, okay? It can lead to this concept called moral hazard, okay? Because in that situation, the patient is totally vulnerable, they're scared, they don't know what's going on, and the doctor can actually exploit the patient, okay, and order a bunch of tests or have them do unnecessary treatments or whatever just to make, so that they can get paid. So if that is a situation, that would be moral hazard. And in that in those cases, it results in waste and also exploitation of the patient. Okay. So next, what we have some other characteristics that differentiate the United States healthcare system from the rest of the world is the fact that we have third-party insurers. We are a multiple payer system, as opposed to other countries like Canada, the UK, or even Germany. They all have single payer systems. We have multiple payer systems. A multiple payer system. So the difference is, if you are a single payer system, you only have one payer, okay, one party that's paying for everyone's healthcare, whether it be a sickness fund, kind of like a mandated sickness fund / insurance for the country, as in how like Germany handles things, or if it is like the UK or Canada, where they use the taxes and they create a budget, and then they give universal healthcare for everyone, so that and everyone that works in healthcare is really a government worker. Okay, in those situations, those are single party payer systems because there is only one payer paying for everyone's healthcare in the country. In our situation, in the United States, we have a multiple payer system. So we have a bunch of different third-party payers. It's so many, it gets super cumbersome. Like, it can get confusing, it can be thrown off because there are no standardizations, first of all, across, like when you compare all these different plans. So there are numerous different plans. They're all different types of plans, different ways that everyone pays, the different things that are paid for by different insurances, and then like one insurance may pay for a certain treatment, and then another insurance provider, for a certain patient, maybe they don't pay for that certain treatment, or maybe there are other provisions that have to happen in order for that patient to receive that certain treatment according to that provider or insurance provider. Okay, so there are numerous different ways that it gets paid by these third-party insurers, and it gets crazy. It's so cumbersome that they created a whole profession for people who have to deal with medical billing. Other countries do not have that. They don't have that occupation. Okay, because it's not really needed. They have a single payer, the government handles it, or whoever. But over here, we do not have that. Okay, we took the hard way, and we just have so many different payers. Okay. We also have this whole power balancing situation. Okay, remember that initial, it's right here, the initial photo that we went over at the beginning of this chapter, where all these different parties or different fragments of the healthcare system were all trying to chase down the behemoth that is the healthcare delivery system in the United States. Okay. So the thing is, everyone, physicians, administrators, insurance providers, the government, employers, everyone, all these different fragments of the healthcare system, they all have their own self-interests. Okay? And the thing is, no one actually dominates over the other. That everyone's trying to get one up on the other so that they can, like, get something from the healthcare system. Okay? Forward. All right, so some more things that differentiate us. Next, we have legal risks. Guess what? In the United States, we love suing people. It's like one of our favorites, right? We love suing people. And one of the biggest things that we can sue in this country, probably one of the most easiest targets, because, you know, medicine is just so fragile, you know, with human life and everything like that. So it's so common to sue your practitioner for malpractice lawsuits, okay? And physicians, practitioners, they know this, okay? And many of them are scared, all right? They're all afraid that something could slip up. They could make a mistake, but something could also slip up. It might not even be their fault. They could get in trouble and be sued, okay? So what many practitioners do is they practice defensive medicine. So a defensive medicine is basically just going all out for the patient. You're prescribing possibly like unnecessary diagnostic tests just to make sure you crossed off every single possibility. They'll make sure that they do return checkups, double check documentation and things like that. So practicing defensive medicine. Defensive medicine is not the best thing to do with respect to costs, okay? Because this results in a lot of waste, okay? And it drives up our healthcare expenditures in the United States. So it's not the smartest thing to do, but I get it. A lot of these practitioners, they just don't want to be sued. They want to keep themselves safe, okay? Next, we have technology. Our medical technology is top-notch, right? We lead in research and innovation, and we have this technological imperative in the United States where as Americans, we just believe in having the best of the best and really just developing new technology, okay? We don't really care about the high costs. We just want to keep dumping money into the research and development system for healthcare and keep developing as much as we possibly can. The government actually invests a lot of money into research and development for healthcare. Usually they actually do this through the Medicare program, and the Medicare program funds a lot of the research and development for teaching hospitals. Okay. So this is the different levels or continuum of services in healthcare. So there are 3 different types of categories in healthcare. There's the curative. Crap. I am not doing well with this pen, huh? Well, anyways, there's, You know what, you guys can go ahead and read that slide. I'm not even gonna go back. I'm sorry, I suck at technology. Sue me. Actually, don't sue me. Please do not. Anyway, so now we're going to look at the government's roles in the United States healthcare system. Okay, so what role does the government play in the United States healthcare delivery system? They are a major financer. Okay, and for the most part, the two largest, most common healthcare programs that they have are Medicare and Medicaid. Okay, so what the government does is they created the Medicare and Medicaid program, and then they determine the reimbursement rates to the providers who accept Medicare and Medicaid. Also, what the government does is they do provide some policies, some regulatory policies, which is mostly Most of the regulatory policies have to do with health and safety in healthcare. They also regulate the licensing requirements of our practitioners, and they create the health policies in public health, okay, not so much in medicine. Let's move forward. Okay, here. So this is the quad function model. So there are four functional components of healthcare delivery. Okay, so first is financing. And so financing is the part where money gets dumped into the healthcare system. And you're probably thinking that's insurance's job. No, that is our job. We're actually the financing part of healthcare. Okay, so whether you pay your your premiums for your private healthcare insurance, or if your employer takes some cut from your paycheck and puts that towards your health insurance, or if you just pay taxes, okay, you're financing healthcare. So pretty much everybody is financing healthcare to some degree, even if you're just someone who maybe you do none of that, but you also donate to charity, like a charitable organization that, that helps with paying for healthcare. Okay, so pretty much everyone is putting money into the healthcare system and letting that money sort of circulate its way through. Okay, so the next functional component of healthcare delivery is insurance. So the main thing about insurance, or the main objective of insurance, is to protect against catastrophic risk. Okay, so in healthcare, that's risk to our health. Okay, so the thing about health insurance and risk to our health is that it's totally unpredictable. Okay, so insurance, what that does is it kind of gathers all of the money that it gets from us, okay, and it puts it all into a pool, and it's there in that pool, and then whenever there's some sort of catastrophic event from one of the beneficiaries who have been putting money into that pool, then the insurance agency pays for it. Or, the purpose is so it holds that money in that pool for the beneficiaries whenever they have some sort of catastrophic event to their health. Okay, so the third functional component of healthcare delivery is delivery. Okay, delivery portion. This is the best part. This is where you get your treatments and your diagnostic tests and your services from your provider. Okay, so this is the part where you get worked on. All right. Next, the next functional component is payment. This is the part where reimbursement happens. This is the part where the insurance pays the provider. Okay, insurance will pay the provider. When you get your delivery, insurance takes the money that you've been putting into that pool and it gives it to the provider. Okay, so that's the whole all four functional components of healthcare delivery. That one, and now let's look at national and social insurance systems. Okay, we're going to compare national and social health insurance systems. Right now we're going to look at national health insurance systems, and so when we're looking at this, the countries that you should be thinking about are, let's think about just Canada and the UK, right? Canada and the UK are going to be our national health insurance system countries that we always use as an example. Okay, and you're going to see that on exams as well. So anyway, so some of the major components of a national health insurance system is that it is financed through taxes. Okay. All of the providers, all of the practitioners, those are all going to be government employees. They are hired by the government and they're paid on a government salary. Okay. In a national health insurance system, the whole system is a government enterprise. Okay, there's nothing private about it. So the whole system is a government system, and anyone who is a practitioner is a government employee. They get paid a government salary. Okay, and how this is all done is because their governments will have this thing called a global budget. Okay, and this global budget is going to be basically their budget that they're going to use to distribute amongst, or to their this is what they do to kind of determine where their money for healthcare is going to go. Okay, so their global budget is built up from the taxpayer money, right? And then they just sort of figure out exactly how they're going to allocate those funds. So they're going to, they determine how much they want to invest into research and development from this, how much equipment they want to buy, if there are any new hospitals they feel like they need to build to keep up with like the growing population, if there's like any kind of new technology, any medical supplies that they need to invest in their healthcare delivery system, that would fit into their global budget. Also, same thing with like everyone's salary, all the physician and nurses and other healthcare practitioners, their salaries will fit into the global budget. Okay. And this type of a healthcare program, there's universal access. Okay. Theoretically, no one is going to be uninsured. That being said, I'm sure you guys have kind of heard of the downside of having universal access to healthcare. That being said, the reason for this is because the country can only come up with so many resources to allocate to healthcare. Okay, so many resources for their healthcare programs, and they have to find a way to be able to allocate that evenly throughout the whole country. Okay, to make sure that all citizens are at least provided a certain standard of healthcare. Okay, so usually in a universal access type of a national healthcare program, everyone's going to have your basic preventative care, primary care, and whatnot, and you may have some. I'm sure there's going to be secondary and tertiary care as well. However, it's going to be based more on the need, not necessarily like, if I were to go and start demanding that I need, such and such work done. Okay. Many times now in our country with our private health insurance, some fancy health insurance can allow you to kind of just jump and bypass your primary care physicians, allow you just to go straight to a specialist, and you can talk about whatever you want with the specialist and get them to, do whatever you need them to do. And many private health insurances will allow you to do that in the United States. You can bypass certain points in our healthcare system, but you can't bypass any of that in a national healthcare system. You go straight to your primary care provider, and they kind of will direct you to wherever you need to go within the healthcare system. But it starts with your primary care provider, and they're just going to, they'll take care of you at that point, and then just see what is allowed and what they can do for you from there. Next, we're going to look at social health insurance and systems. So In a socialized health insurance system, well, first of all, the countries that we're going to look at, or anytime we talk about a socialized health insurance system, we are going to be thinking of Germany, Israel, and Japan. Okay, those 3 countries, we're not going to bring up any other country. Those are examples, okay, for the whole quarter. All right, so anyway, the basic idea with a social health insurance system is that their system is technically private, okay? So they're allowed to own hospitals, businesses, private, practices, multi-specialty practices, imaging, like they're allowed to own their own healthcare businesses. That being said, it is going to be paid for through one single payer, okay? And okay, the government still is the central governing agency of the healthcare system, yes. The government also is going to, well, the government is the central healthcare agency. The government creates the policies that everyone has to follow. The government will set the standards for everyone in the country. And so the government exercises overall control over the system. However, like the different facilities and whatnot can be private. Okay, so they can be private, and they're usually going to be delivered by private providers. So they're not going to be working on a government salary. They're not going to be government employees. You're allowed to own your own businesses and hire your own employees, your own workers. So that's cool. How does it get paid for? The government mandates that that employers and such like that all contribute a portion of their income and of their profits to what they call like sickness funds, or pretty much just like a separate like insurance but for the whole country. Okay, so every employers and whatnot, they all have to contribute a small portion of money to this gigantic insurance pool, and then that insurance pool is what pays for everyone's health care. Okay, so it's still a single payer. The government still has overall control. The government makes people donate or contribute to the pool of money that's going to pay for everyone's health insurance. It's almost kind of like taxes, but it's not really taxes. Okay, so anyway, that is social insurance, and that is the rest of chapter 1.